The mayor of Taipei and the health minister held an emergency meeting on Friday to form containment measures for the COVID outbreak in the capital. After the meeting, they announced that free COVID testing will be available in and around Wanhua, the epicenter of a recent cluster infection. Those with COVID symptoms are encouraged to get tested even if they're an undocumented migrant worker. Taipei Mayor Ko Wen-je said workers without valid documents will have amnesty at test sites and will not be subject to fines or deportation.
Ke is waiting by the elevator as Health Minister Chen Shih-chung steps out and greets the mayor with a salute. This is Chen's first time visiting Taipei City Hall, and he's here to talk strategy over an outbreak at Heping Hospital. After a one-hour meeting, the city mayor and CECC commander took the elevator down to the basement to announce new COVID precautions at a joint press conference.
We have communicated with local experts and Taipei city officials over the issue. We will still use our collective past experience to fight the outbreak together and reduce the risk to zero. Our two sides were able to reach a consensus during our discussion. This pertains to anyone who's been an employee or customers of Wanhua District's tea parlor since April 15th. Anyone who sought medical care or purchased medication in Wanhua for a fever and upper respiratory tract symptoms. Rapid testing clinics are available at Zhongxing Hospital, Heping Hospital, and West Garden Hospital. These clinics are already set up. We'll be adding another quick screening station at Wanhua's Bo Pi Liao at the recommendation of the Central Epidemic Command Center.
4 rapid test stations will be up in and around Wanhua for use by the workers and customers of the district's tea parlors. Wanhua residents with COVID symptoms can also get tested. Eligible persons include the homeless as well as undocumented migrant workers who will not be prosecuted for coming forward.
There are currently more than 50,000 migrant workers without documentation. Anyone who presents themselves for testing or medical care will be granted amnesty. Many such migrant workers fear being arrested if they come forward. Today, for the purposes of combating the epidemic, we're granting amnesty. You won't be sent back to your country just for going to see a doctor. That won't happen.
Over at Heping Hospital, disinfection is underway. It's a scene grimly reminiscent of the 2003 SARS outbreak that prompted a lockdown at the hospital.
Of course, there are reasons for initiating a lockdown. In circumstances that spiral out of control, lockdowns are a last resort. But Heping Hospital currently is not in such a circumstance. Yesterday, many of the medical workers identified as high risk were sent to designated COVID-19 hospitals. This morning, another group went. These medical workers have been situated one to a room. They have not been locked up in one place and left to fend for themselves. So that's been an improvement.
The CECC and the Taipei city government announced countermeasures for Heping Hospital's outbreak. For now, no patients will be admitted or released at hospital wards where there's a confirmed COVID case. Contact tracing will be widened at the hospital and immediate testing arranged for personnel and patients. Outpatient and emergency services will be scaled back and their premises disinfected. In addition, the hospital will not be admitting COVID patients or suspected COVID patients to prevent further spread of the epidemic.